thinking around this area and have used it to leverage European Commission funding actually to drive some of our research programs and agendas. So I will give just a bit of background myself. I will talk about those strategic areas. I'll talk about how we created sort of 4 research pillars. We merged the 2, and then I'll give an example of one of our EU projects, and this one's Proac. This one I'm coordinating myself under the Horizon 2020 framework. So our centre, I mean, when we started 4 years ago, I was the only full-time member of staff, and we went out into the big bad world to understand digital health and look at my background in psychology. So I got to take psychology, look at the allied health professionals, look what's happening in primary care, and bring technology to homes. That's really what we wanted to do into the community. 4 years later, we now have 13 staff, 8 PhDs and 2 masters by research, and we have more staff coming on board. We try to develop world-leading innovation in digital health, and the projects we've built in the last, I suppose, 2.5 to 3 years, the consortiums have secured about €17 million, and off that we've taken our portion to facilitate our projects. So about 3 years ago, that's my first trip to Brussels, where I gave an 8-minute presentation, and then over the following years going back and forth building these teams. And this photograph here, that's Coordinators Day in the Commission about 6 months ago, where we all meet to discuss some of the projects we were working on and get some advice and bureaucratic guidelines about what not to do. So we had a couple of unique selling points before we started. It was really to, as I said, look at what we can take from psychology, allied health professionals, take that knowledge to the design of digital technologies, particularly for patient care, management, service delivery, and being within a school of nursing, the centre itself, even though my background in psychology, we get access to trial sites, patients and clinical partners, which we could leverage within European programs. These are some of our collaborators now. Well, everyone on this slide is a collaborator, either in a project that's just completed, or one we're just about to start. So it includes multinationals like IBM and Philips, some policy groups like the European Association for Service Providers for People with Disability, some trial sites and SMEs, and iMinds, which would be, for example, the largest living lab in Europe. So it has a trial site of 120 smart homes clustered together just outside of Ghent. But 4 years ago, when I first started, this is what I was faced with. You know, we set up this idea of moving into digital health, and it was just a multitude of companies, a lot doing the same things, some doing different things. Everybody was an influencer or a trendsetter. It was just impossible to separate really the kale from the cabbage. And over a couple of years, I got to realize 98% of it was cabbage. So it's kind of strange, because we see both very, very similar. In this slide, everything kind of looks very much the same. But really, it's finding that mystical property of really some really good companies to work with, really good people to work with in advanced digital health. And the other thing is, the grants we were targeting, the success rate's 2 to 3%. So you've got to be absolutely laser focused on your idea, how you strategically think and what you want to develop, and how you build the teams. So really it was us finding our key ideas. So what I said is, I got the team, I said, let's step back from that about 2.5, maybe 3 years ago. And I said, let's figure this out for ourselves. Let's look at the relevant research, let's look at the relevant policy, the relevant sort of economics behind this whole area of digital health, and come up with some kind of strategic focus. So the first thing, this is what we took from all of that, so this is condensed. What are the key challenges of digital health? Well, first of all, it's in its infancy. There's a lack of standardization, as we all know, across the board when it comes to deploying technology. Completely fragmented. The health systems are fragmented, but digital health, integrating that in, is a massive challenge. It's hugely fragmented in terms of data storage, treatment, reimbursement models. Huge cultural diversity. We're working with Philips in one borough in London. I think there's 68 languages they have to deal with when they're trying to deploy Motiva, which is really astonishing. There's low investment compared to the likes of banking. A lot of regulation, and particularly around that sort of ethics and privacy and data protection, and with health data being so sensitive, this has to be this way. And then there's duty of care and medical negligence. So we start developing these technologies and what happens if something goes wrong. We all know technology can go fail, it can be very complex. And where does the duty of care lie? we then said, what's driving the market? So we know the challenges, what's really driving it? So we know there's this shift towards home-based care. That's huge now. We need to know from the data how we make better and more efficient and more flexible workforces to support people moving home. Big data, the demand for accountable care, particularly across the care continuum, and this growth in digital integrated care. The Internet of Things, I think that's been around for a while. We've just cloned it into a new phrase. This is my sort of feeling on it. Again, this all ties into this need for social integration of technology, particularly, as I said, as we move towards home-based care and the growth of wearables. So from all of the documents that we were looking at, these were kind of the key market drivers. So then I said, right, okay, we know the challenges, we know the drivers. I need to pinpoint seismic shifts. What are the seismic shifts we need to understand in digital health that will actually help us focus on something of relevance? So the first one was the population shift in the EU. So this shows, this graph here, the cumulative percentage increase in population. And what you see here is this light blue line. It shows just the cumulative growth from 2003 to 12, about 3% for the general population in the EU. But when you look at over 65s, it's close to 14. And then if you look at the demographic in Ireland, it's the exact same trend. You have these 10 cumulative points, this huge population shift to over 65. So we need to be building in this space. This is a critical transition in terms of what we're looking at in the EU. The sort of second seismic sort of area we kind of wanted to look at was in health, where are the kind of, I suppose, people wanting to spend their money and what makes sense to the purchase. And again, it mirrored that strategic point one. If you take this portion of the pie, which is monitoring, and this portion, which is diagnostics, that's 80% of that pie chart. And if you take then, this is actually from one of the things we looked at from PwC, this is looking at this 23 billion global market. 71% of the mobile or digital health applications are in independent aging. That's where they kind of see this by 2017. So we were sort of thinking that based on this, what we're kind of seeing is this whole idea of people do want to live longer at home. We have a rising demographic population over the age of 65. Forces are starting to align here that we can actually build a project. So we're constantly trying to push in this direction. So the third kind of area that we kind of came off in the research too was the health systems are built in single disease treatment and reactions to the single disease treatment. So you've got a lot of single disease solutions. We wanted to look at more, because we're seeing a shift towards home-based living, more independent aging, and the population growth in that space that the health systems can't cope with. We need to shift from reactive treatment models to proactive treatment models. So how do we design tech to allow that proactive shift? That's kind of what we were trying to push into. And how do we challenge the single disease model of care actually? And that led us to our fourth point, the rise in multi-morbidity. So I'm kind of, when I talk about digital health, I'm talking about, look, managing health conditions as opposed to digital fitness. We fit and trying to track. So really trying to get it. And we kind of looked at, this is a great paper in the Lancet, and it was done in Scotland with about, I think, 1.8 million people in Scotland. And what it showed, and what has been replicated in many EU studies, is that when you get to 65, which is where I said in point one, this shift is happening, 2/3 of the population, roughly, in most countries in the EU, that age group will be living with 2 or more conditions. And that's what's putting a lot of pressure on the health services. And when we've been mapping out the care pathways recently for various health systems in Europe, there is no multi-morbidity pathway. So it's very much detective work for a lot of clinicians in terms of where somebody goes next. You have maybe geriatricians that are probably best placed to guide patients when they come to hospital, but really it is detective work. So we kind of looked at this, and this is a great graph. If you ever get this paper, this is great too, because it shows you the disease states, and then it shows the correlation of symptoms. And it shows you if you tackle certain symptoms, you can then affect multiple disease conditions. All these single apps, like that first slide, which means it just becomes so fragmented, and even human behaviour couldn't cope with the amount of applications that we need to give to somebody to manage conditions as they get older. And these are just some statistics on the right-hand side in terms of when we looked at the population that it would affect, as well as the cost. And actually in red, what we then highlighted was where the pain points were, particularly like, for example, COPD. Key pain point is repeated hospitalizations. We looked at what the the budget would be globally in terms of how that affects health systems, and then how we design a study to keep people at home over 65 that might have multi-morbidity. That's really where we want to focus. So we spent a good year trying to strategically think, how do you challenge digital health correctly? Instead of saying, I've got a great app that's going to help change, how do you really strategically affect change? So, I don't know how long I'm going to quickly go through it. I'll just quickly fly through this. So we talk all about strategic thinking, and being researchers as well, we had to create research pillars around all of that strategic thinking. So we built 4 pillars. We said we need to improve patient engagement. That's really important because at the minute, digital health holds a lot of promise, but ultimately it's kind of failed. It hasn't lived up to that promise. So a huge area is this patient engagement. We need to take the data and understand how we make more effective, more efficient workflow, services and organisations from that, how we help health professionals and care support actors, I suppose, direct their services better to support people, particularly those wanting to live at home. Then that comes into advancing the use of home care ICT, and then how do you change and make those, as I said, those proactive models of health as opposed to reactive. So we built all of this into this huge big proposal that took, oh God, a year to write, everyone together, and it was called Proac. And we applied to the Commission for funding. They gave us our funding, and we started in January. We have our official launch on the 8th of June. But as I said, what we want to do is challenge that single disease treatment model of health to look at a proactive, community-based health analytics-driven model that's targeted around over 65s living with multi-morbidity. That's the pain point. That's what we want to challenge. We want to crack. We also think if we can crack this idea of managing disease states on one platform, then you can crack that patient engagement thing. So we're kind of pushing on that. So I'll just quickly fly through what we've set up. So we've got 6 countries, 12 partners across 6 countries now involved. We have IBM and Philips joining forces to help us build the cloud system that will, and also working with a lot of Philips sort of clinical systems in terms of taking clinical data. And we have trial sites set up in Ireland, in Belgium, and in Italy. As I said, what we want to focus on, and I'll try and quickly race through this, we're looking at integrated care for over 65. So when we decided we had to build this project, we decided we had to identify who the key people are in primary, secondary, tertiary care, and we had to cover healthcare, community care, and social care. And that's a big, ambitious challenge. In a simple nutshell, and this is very kind of high level, what we did is we mapped out the care pathways. We identified all the key actors in it. We then are working with IBM and Philips to build a new cloud aggregation system that can take data from the devices and ones that we create, and also a second open API in which we allow the integration of social applications from SMEs. So we want to try and look at, and there's a lot of work into understanding holistic care of individuals around both clinical and social data. So we're trying to merge the two for the first time. It's also the first time IBM and Philips have opened up their systems to talk. Philips is normally a very closed company. So it's been a lot of work to get, a couple of years to get to this point. So I'll quickly just jump this really. Really what we've done is we've set the trial sites up, and we have in those trial sites hospitals, pharmacists, GPs, formal and informal carers, and some peer networks set up, and they're all going to get the technology. I need to do a separate presentation on how this all works, but basically that's what we're going to do. And just to summarise, so I'll show the website link in a minute. You can follow it. We're starting to publish stuff on that website. There's some white papers on there to the public as well. But we look at defining this ecosystem. We look at understanding what is the relevant technology you give to people, the use of the data, how we protect that data, a behaviour change framework for people in the system, and then how we transfer it. So we're working with the EU on a transferability study about how we can take the system across member states, which is going to be a hell of a challenge. But that's just my talk, just EU research.